Video will show you how to use a hygiene sling to transfer a patient onto a toilet or a commode.
Criteria for using the hygiene sling is the patient must be able to sit unsupported and follow direction.
With the patient sat unsupported and with their feet flat on the floor, apply the hygiene sling around the patient's waist. Make sure that the sling is snug so it doesn't move around, but also not too tight for your patient. If you're unsure which way round the hygiene sling goes, make sure that the soft bit is at the top. Lower the carry bar so it is in front of your patient and the loops of the sling strap can easily reach. Position the leg straps underneath the patient's thigh. Cross the straps by threading one of the straps through the lower part of the other one. Attach the sling strap loops to the carry bar. Aim to use the longer loops at the legs and the shorter loops at the waist. This will help your patient to be in more of a seated position when they are transferred. Transfer your patient. Check with your patient and remove any clothing necessary for toileting. And lower your patient onto the toilet or the commode. Remove the sling loops from the carry bar and remove the leg straps. This is an alternative method of sling application with 2 caregivers and when your patient is in bed. Adjust the bed so the patient is in a seated position. Ask the patient to lean forward and place the sling behind their back. Apply the waist strap. Again, make sure it's snug, so not too tight but also not too loose. Position the leg straps underneath the patient's thigh. Make sure that they're flat. Position the carry bar of the lift over the patient. Cross the leg straps. Connect all 4 loops to the carry bar, aiming for the longer loops at the legs and the shorter loops at the waist. Check that your patient's ready and transfer them, making sure that all the loops are properly connected. When the patient is over the toilet or commode, check with them and remove any clothing necessary for toileting. Lower them onto the toilet or commode. Make sure that as they're lowered that their pelvis is at the back of the toilet seat or the commode. Remove the sling loops from the carry bar and remove the leg straps. The patient can now toilet. Check out the description box for links to safe work procedures. Thank you for watching.